Antibiotics are medicinal agents which are used to kill the microorganisms and treat certain infections. Before starting antibiotic treatment or the treatment with antibacterial agent, it is very important to diagnose the type of pathogen. This can be done using different techniques such as gram staining. For gram staining, fluids from the patient can be taken from different body parts such as blood, cerebrospinal fluid, fluid of brain and spinal cord, pleural fluid, fluid from the lung, synovial fluid, the fluid of patient joint. This gram staining helps in identifying different morphologic features, and it is very easy to diagnose the type of pathogen which is causing disease, and the treatment can be done according to that. For most effective treatment of any pathogen or for the diagnosis of certain pathogen, sample culture can also be done. The sample from the patient is taken and in the lab it is allowed for bacterial growth by providing it optimum temperature, favorable conditions and the respective nutrients for its growth. When the culture is negative, it tells the type of organism which is actually present by positive culture of other microbial growth. But this test should always be done before the first dose of antibiotic has been taken by the patient. Otherwise, the negative culture can be confusing and this may indicate either the absence of bacteria or the effect of antimicrobial agent. Some newer lab techniques are also there to identify the type of organism, such as rapid polymerase chain reaction (PCR), matrix assisted laser desorption, and mass spectrometry. They offer accurate, rapid, and cost effective identification of infecting microorganisms. The antibiotic therapy is started after the diagnosis of the certain pathogen, but if the patient is critically ill and delay can be fatal. For this, normally broad spectrum antibiotics are used, but this should be substituted by the narrow spectrum as the culture or sensitivity report of the patient comes. When the patient coming for the treatment is suffering from neutropenic infection, such as due to decrease in his neutrophil count, or is suffering from meningitis, such as inflammation of brain and spinal cord membrane, he should be given treatment earlier and the timing should be very adjustable. It means as the specimen has been taken from the patient and before the culture test report comes, he should be given the antibiotic or empirical treatment. In the absence of susceptible data, for example, the report of the patient has not come yet and the pathogen has not been identified, the doctor prescribes the drug according to the present knowledge. For example, the site of infection, in which organ the patient is having infection, that helps him to prescribe the antibiotic empirically. The other point is patient history. He will ask patient for his previous or recent antimicrobial therapy, his previous infection, his age, his recent travel history, and his immune status. This will help a doctor to prescribe an empirical antimicrobial therapy. The other thing which helps him is the clinical associated symptoms. Sensitivity to specific antibiotic helps a person to prescribe a drug against that infection. Antibiotic can be of two types according to its effect. It can be bacteriostatic or bactericidal. Bacteriostatic means the antibiotic is only able to prevent the growth of that bacteria, means the infection will not be spreading anymore. But bactericidal means the antibiotic will be able to kill. One antibiotic can be bactericidal for one infection and can be bacteriostatic for the other type of bacteria. This depends on its dose. However, recent data have demonstrated that bactericidal and bacteriostatic agents both have similar efficacy for treating a common clinical infections.